So this week's outcome measure of the week is the PASS, the Postural Assessment Scale for Stroke. So the PASS is a 12-item outcome measure for patients post-stroke. It's highly recommended in the acute phase in stroke recovery, and it is on the ANPT EDGE stroke document. And it has more or less two sections. The first 5 items are static postural assessment, and then the final 6 items are dynamic assessment, and there's different scoring criteria for each item in the static section, and then in the dynamic section it's kind of all based on the amount of assistance that they need. And this outcome measure demonstrates large responsiveness to change, especially in the acute setting, which is really good because it helps us kind of determine how the patient's progressing, what we're doing right, what maybe we need to change, and it can also help justify further physical therapy visits. And it's a really efficient way to communicate between therapists in documentation, kind of regarding what their mobility looks like by just listing the number on the PASS and then listing their score. And it can make it easy to kind of quick look at that, understand where the patient's at instead of having to go through and read a ton of notes. I know at the hospital that I'm currently at, all patients that are on put on stroke protocol have the PASS performed on day 1 and then on day 5. And there are minimal detectable change values, and it's a highly validated outcome measure. I don't remember all those numbers, but it is a highly validated number or measure. I do know that. I will link it below as always. I'll link it to the Show Your Ryan Ability Lab link so you can download the document from there and you can look up the statistics that you might need there. And I'm going to show a video now of me performing it on my co-resident Jessica. She might not score perfectly in all of them, and I'll kind of go through what I scored for each of them. All right, so today we're going to demonstrate how to perform the PASS. It's the Postural Assessment Scale for Stroke. Here we have Dr. Anderson. She's my co-resident. This is what residents do on their weekends for fun. So I'm going to pretend I kind of just came into the room, and she has left hemiparesis following a stroke. So, hi Jessica, my name is Jonathan. I'm a physical therapist. Is it okay if I work with you?
Yeah.
Okay, great. Hand sanitized, don some gloves. Okay, Jessica, can you go ahead and roll to your left for me? Okay, good. Come on back. And Jessica, can you roll towards me? As much as you can. Reach for me. Reach for me. Reach. Good. How you feeling?
That was harder.
A little tougher? Okay. So I was giving like minimal assistance there, and then she was able to kind of do the rest. And then can you go ahead and sit up on the edge of your bed here for me? I'll give you as little help as I can, okay? Keep pushing. Push. Good. How you feeling?
Okay.
Feeling okay? All right. So now that we have her in sitting, we're going to kind of assess her sitting ability. Can you go ahead and just sit there for me? Chair over. How do you feel? Pretty stable?
Yeah.
Okay. We're just going to hang out here for a few minutes, kind of looking at some of your sitting balance. Sit up nice and tall. Good. Okay. Still feeling okay?
Yeah.
All right, good.
I just drift a little bit sometimes.
Just a little bit sometimes, but that's okay. I'm going to go ahead and put this gait belt on you if that's okay.
Okay. I can hold on to the table.
Thank you. I'm going to round you here. This gait belt is super long. There you go. Thank you. There you go. It's not too tight, is it?
No.
Take a deep breath. Walk her over.
All right.
Okay. So can you go ahead and stand up for me? Good. You put that hand on the walker? Nice. And we're just going to hang out here for a few seconds. How you feeling?
It's okay. It's kind of hard to stand up a little bit.
Okay. You feel safe?
Yeah, the walker helps.
Good. This gait belt is like 8 feet long.
That's what happens when you use a mobility strap as a gait belt.
Okay, can you go ahead and stand and let go of the walker for me? I've got you here if you need it. Good, and let go of that right arm. Good. Keep your hand off the walker. Good. I don't remember how long I'm supposed to hold you. Okay, good. Go ahead and hold on to the walker. We're going to do that one more time, okay?
Okay.
Go ahead and let go. Good. And can you reach your right arm up and hit my hand? Hit my hand. All right. A little tougher with that?
Feel a little unstable when I do that.
Okay. So we're going to try and let go of the walker again.
Okay.
And can you stand on that right leg for me? Good. Keep holding it. All right. That it? That all you got?
Yeah.
Okay. Can you go ahead and stand on this left side for me? Can you let go of the walker when you do it? Okay.
I don't think so.
Yeah, that looks like it's going to be a little bit tough.
Might be a little dangerous.
Oh, yeah. And I don't think we're going to make you bend down and pick an object up or anything. Does that sound okay?
Yeah, I think that
Might be a little tough today.
It might be a lot.
All right. Can you go ahead and have a seat? Good. I'm going to take this belt off of you.
Okay.
Okay. And can you show me just how you get back into bed? I'll give you a little hand if you need it.
I can. Yeah, I might need a little help. This.
Little hand?
Yeah.
Good.
Okay.
And then we'll roll onto our back.
That's it.
All right. Feeling okay?
Yep.
Okay. So that is a very brief and attempted demonstration of how to perform the pass in clinic. And then we'll kind of go over the scoring here in a bit.
It's a little quick and dirty.
That's it. Thanks, Jessica. Thanks for pretending you were left-handed.
No worries.
So that's the pass, and again, that's the postural assessment scale for stroke. It's highly recommended for patients in the acute phase of stroke rehab. It has a large responsiveness to change, and it's something that I would highly recommend being very familiar with, especially if you're in the acute care setting and you're working with patients post-stroke. So that's this week's outcome measure of the week. Thanks for watching.